Hello to everyone, and thank you for being here. As promised, we will try to gain some time. So just before starting the panel, you can introduce yourself a bit more, to the audience, just explaining briefly what you're in charge in your company.
Sure thing. So Johannes, principal at Calmstorm Ventures. With Calmstorm, over the last 4 to 5 years, we've basically built the most active health tech investor in Europe, having done almost 90 investments over the last 5 years. What we do is we try to come in as early as possible, pre-seed and seed with tickets up to 1 million. We invest across both Europe and North America. And currently we're raising our second fund. So if there are any LPs amongst you, then don't be shy.
Thank you.
Hello, everybody. My name's Justin Coffey. I'm Chief Medical Officer at Workit Health, a US-based tech-enabled service provider for individuals in recovery from substance use disorder. We're a multi-state organization with venture backing and founded by 2 women in recovery from substance use disorder. So delighted to be here.
Okay, thank you.
Thank you. My name is Patricia Ripoll. I'm basically a patient. Okay, I'm a migraine sufferer from more than 40 years. And now I'm also the president of Fundación Visible, where my mission is to integrate the patient voice into the healthcare system. And also, we try to make visible what is invisible.
Okay, excellent. So my name is Marta. I'm the Chief Patient Officer of Servier, that is a pharmaceutical company. So in the last 3 years, we are trying, because I cannot say that it's already done, to transform our company from a classical model in a patient-centric model. So that's my daily work. And I also a free consultant of nutrition for a patient organization. So during the last sessions, we have heard a lot about patient voice, knowing what is important for the patient. But in that case, we are lucky enough. We are a patient with us, which is not so frequent in most of the panels. And I would like to start with a brief introduction, say, what is for you, from your perspective, your work, what is really to be a patient-centric organization or a patient-centric solution? Because very often we discuss about that, and very often I realize that the definition is not the same for all the stakeholders. So I don't know, can you start?
Okay, then for me, to be, it's not just about saying patient at the center, it's to believe in this and to put some tools to arrive to this patient-centered view. Because we are always talking about, yes, we are doing for patients, we are doing this to the patients, but the thing for me to be patient-centered, it's to work with patients all the time. And then if you work with patients, probably, it's not sure, probably you are changing a little bit your mind, and then you are going to shift to a patient-centered approach.
Okay, thank you. Johannes, from your perspective of the things that you see working and listening to other companies, what is really to be a patient-centric company?
Yeah, I mean, to us, from the investor's perspective, I really think that this current wave of digital health, it's all about patient-centric solutions. Like if we look at it over the last, 5 to 10 years, where we started in digital health, from the VC perspective, in the beginning, it was a lot of like consumer-focused solutions, let's say digital therapeutics, at-home monitoring, telehealth. But over especially the last 5 years, I think we transitioned quite a bit into also B2B solutions, what we also call the digital health backend. So think any kind of software for healthcare providers. I think initially like the smaller, more fragmented providers, specialty practices, general practices, but now even more so, I think also software to automate any kind of clinical or admin tasks in larger hospitals. So also the large providers are being tackled now. And I think it's not only those consumer-facing solutions, but even those kind of back-end solutions that at the end should play into the end consumer in terms of making sure that the clinicians can focus on the patient, but also making sure the patients can spend more time with the healthcare, ask the right questions, get more time with the clinician and also interact with technology.
Okay. From your side, Justin.
From my perspective, patients ought to be the ones who design every aspect of the delivery of care, period. At Workit, our mantra is patients as designers. So we actually have patients not over on the side in a patient advisory council that meets once a year,
No.
that's asked a few questions, but literally employed at every level of the organization, including frontline clinicians and the executive suite, that are literally at the design table. I think it's important to focus on the delivery component of that, not so much the evidence-based component of it. I think patients generally do not want to be abandoned to their own autonomy. They want the expert care team to help guide them on what does the evidence say would work for me, what are the risks and alternatives of that. But in terms of how I receive the care, how that care is delivered, where it takes place, when, that is the power of putting patients right in the middle and surrounding all of that delivery around them.
Okay, thank you. I really like that.
Can I just add one thing to what Justin said? Because I think it's an important point he's making. At the end of the day, patient-centered care is also about where to include the patient with regards to their decision-making. But I think it's also quite relevant to distinguish between cases, but also people where they want or maybe don't want to interact themselves, because it's also kind of a philosophical debate whether we say, for example, are we pushing shared decision-making on patients that would actually prefer simply expert guidance, right?
Yeah.
And there's also all sorts of surveys, and a lot of people say, hey, especially in critical situations, in situations where it's about life or death, maybe it's better if you leave it to the clinicians.
Yeah, I think that your point is extremely important. Very often, and obviously today and every day, we see a lot of digital solutions that obviously, don't misunderstand me, I like them. But often, those digital solutions, they have never been tested with any patient community. Exactly. So particularly when we run trials, we cannot assume, as you said, that everybody will love that. And I have recently, I managed a study like that, and I was really surprised. Most of the people, they prefer to go to the doctor. Mm-hmm. Particularly those that they have a very serious condition. Very often they spend the days at home, and the only moment that they go out is when they go to see the clinician. So we cannot assume that. In some conditions, may be the case, but it's not always the case. So I would like to continue the discussion about, in your experience, what you see, how do you integrate this patient perspective from a practical point of view? I think that obviously you have some examples. Eventually, Johannes, you can see that in the way that other companies, they integrate the patient perspective in the offer, in the portfolio, and also from your side. So I don't know, Justin, you want to start? How you implement that in practice?
Sure. I could talk all day about the examples, so
Okay,
I'll just give one from a technology perspective. So in the United States, substance use disorder care for a long time has been characterized by a lot of shame-based, stigmatized experiences. One of those is urine drug screening, which in many provider organizations is still utilized as a measure of compliance and a reason to withhold or not withhold a prescription. So Workit designed a technology that allows patients to complete urine drug screens using their mobile device from any location. Many of them do it from home, they do it from work, they do it from their car, wherever it makes most sense for them. And it's one of the most frequently cited sources of patient satisfaction for our care delivery system. We did not reinvent the laboratory technology. We simply orchestrated the logistics of getting home testing kits to patients and then developing proprietary technology that allows folks to do this whenever and wherever they please. There's no shame, there's no judgment, there's ultimate convenience, and we were fortunate to have the technology expertise to be able to come up with this type of delivery solution, which is now being deployed through a number of other organizations in the U.S.
Okay. Thank you. Johannes, have you seen, from the companies that you may evaluate, how they really integrate this patient perspective? They really test that, they give feedback, how they do that in practice?
Yeah, I mean, of course, many, many examples, probably within our 90 portfolio companies, you could find like this patient-centered angle in any of those, but just some examples. One of our companies is called Mila Health. They're a mental health company for women, and what they do at the end of the day is they're a matchmaking platform between therapists and patients, because they found out that usually more than 50% of people churn, so they stop therapy with this therapist after session number 3, and that's mostly due to a mismatch with the therapist, so it's not the right person that you're talking to. So they created this matchmaking platform, so the patient all of a sudden can decide which therapist to go to. The patient can also be sent on paths between consultations, so the patient all of a sudden can say, hey, there's this building block of games, of exercises, and all of a sudden you can do that yourself. Just to sprinkle a little bit of AI talk in there, because you can't miss that. For example, we see more or less 200 digital health companies in Europe per month, and we end up investing in one of them. And we see a lot of solutions, also similar to Mila Health that I just described, that are fully automated, that don't even include the clinician anymore. So think of a mental health app that is fully based on AI. I personally am not the biggest fan of that. I feel like it should always be the goal to not substitute the clinician, but actually enable the clinician to work more closely with the patient and maybe process more patients. But just as an example here, another one is, for example, Oscar Health, a company from ours in Germany, and they help people with chronic kidney issues to not transition into that stage 4 or 5 of kidney failure, where you at some point end up going into dialysis, which is also super expensive, and then it's already too late and you can only symptom treat. And they basically get a digital therapeutics app where they can decide themselves how much they want to go about preventing that, which is absolutely fantastic. And lastly, there's also one of our portfolio founders here in the room, Fadi from Healthforce, somewhere there in the back here. And he's in this digital health backend that I described previously. What they do is they help to automate non-clinical, like more admin-related tasks at healthcare providers, especially large hospitals. And at the end, even this kind of solution will play into more patient-centered care, because you know these kind of statistics that a lot of clinicians spend 50, 60, some even more % of their time working on admin stuff.
Yeah, thank you. Very useful. Thank you very much. From your side, Patricia.
Yeah, I'm totally agree what you were saying. The patients are bringing some insights that data cannot go to this, because patients, we give context to everything. Then, if you only focus in data, you will not get this context. And this is why we have 2 examples in our foundation that we are already working in. It's a project called Life After, in Spanish, La Vida Después, and also Elephant, that is a digital community that we are getting all the information from the patients, but it's not we have AI behind, we have a lot of data collected, okay, but it's not only this part. We have personal interviews, we are working with the group of patients, caregiver, families, to know exactly what they want at this moment, what they want to express, what they need. And with all this information, then we try to build solutions or give this information to startups or to pharma companies or, I don't know, to hospitals. And then with all this information, we share with everyone. And I think with these 2 examples, Life After and Elephant, that is this digital community, we are trying, because it's not easy, we are trying to integrate the voice of the patient. And then it's a long pathway that we have, but I think we are a little bit changing the mentality of everyone with these projects.
Yeah. Just to add in that context, coming from a pharma company, one of the main difficulties from our side is really the role of the regulators and how the regulators, they accept that. How to make the best selection of the patients that they are going to be involved. The possible conflict of interest, the compliance is particularly difficult. So obviously we will discuss later on about the barriers, but from a pharma company is quite challenging because we heard about that, but there is a lack of clear regulations about the topic. So I would like to discuss now about the value, because just listening to all of you, what we have listened before, it seems evident that we will need to work with the patient community to listen a bit more to them. But in terms of value, how we can transform that into value for the proposal, for the company, for a product, etc. At least from my perspective, it's not so easy when we need to transform this sometimes insight into numbers, that in the end we need to produce numbers. So I don't know if you have good models, things that you can share with us. You want to start, Justin?
Sure. I think what's hard is not the cognitive work. It's the will. It's the courage to actually listen to the patient and act on what they tell you. In the US especially, the financial incentives are completely misaligned, right? As a physician, I'm not paid to work productively with you, right? I'm paid for different reasons. So that's the biggest challenge. But the incentives are becoming more and more aligned. So if you ask patients, for example, in substance use disorder space, how should we measure the effectiveness of care? They don't say things like compliance or attending appointments on a regular basis. They say things like, I want to get my job back. I would like to get custody of my children back. I would like to have more stable, healthier relationships. Are we measuring any of those things? No. But could we? Yes. And there are now evidence-based, scientifically validated measurement tools for all kinds of social, functional, emotional outcomes. And it simply is a moment, an act of courage to say, we're going to start using those tools, maybe not in lieu of traditional tools that we need to use to measure value for other stakeholders, but in addition to those, so that we know, is the care that we're providing effective, not how I would define effective, but how the patient would define effective.
Okay. Thank you. In your case, Johannes, I would like to, if you can share with us if you have seen, when you need to evaluate a company, how you can measure the value of the patient insight that you have for a proposal for a company, or if you use models, if you have seen good models for with people providing that or not.
I mean, it's tough to quantify, I would say. What certainly is the case, and we see that push, is that patients want to be more involved. I mean, I think we started to see it coming during COVID. I think we all remember like doing, for example, our first, the nose strip test, and we felt like almost our own clinicians all of a sudden doing at-home testing on a mass scale. And this is, I think, where a lot of people also started using telehealth offerings. And I think all of that is super, super good, especially in combination with value-based care coming in, and also the awareness from the patient's perspective, where a lot of patients start saying, hey, we want to see a quantifiable outcome with regards to what we pay, especially in countries like the US, where you just have such a large mismatch between what you put in and what you get out on a broad scale. But for us as investors, I think the most important thing for the founders early on is to be close to the customers, whether that's a patient or a hospital, at the end of the day, and really listen to what they want, because that's what they get money for, to figure out a solution that is valuable to the end customer at the end of the day. And this will differ with regards to the business. Like sometimes, for example, one of our companies, they do eating disorders like anorexia. For them, the quantifiable outcome are clinical trials, because here you're in a regulated space. If you're giving treatment recommendations, and they have to do clinical trials, for example, and in the trials you will see the engagement and pilot the solution with the customers.
Thank you. Patricia.
Yeah, for me the keywords are meaningful impact. Okay, when you are talking about the impact, it's meaningful impact and value for everyone. It's not just, and now I'm changing a little bit from the side. It's not only value for the patient, because you have to have also the value for the professionals, for the pharma, for the investors. You need the value for everyone, and then you will have a meaningful impact for all the society. Because I think sometimes we are moving a lot to try to say, no, we are in the patient center, we are moving to the patients. Yes, and I'm the believer of this, but don't forget that if you are giving value to everyone, and then the result will be better. And then for this, I think we need to redefine the success. Traditional metrics, like saving cost or operational information, it's not enough. And then we have to introduce, like, I don't know if you know the SROI, the social return of investment is more or less like you were talking, is that you have a lot of tools that you can measure, okay, how you are impacting in the people, if you are getting time to them to go to the school to pick up the kids, or to stay at home with Netflix. Let me say, it's something that it's important for this person. And this is the value that you have to look for. And this value, you have a lot of tools to convert into money. And then you can show to the investors or to the pharma how you are getting this money, returning the time, for example, for the patients. Mm-hmm. And then for me, it's clear that we have to move in this. And for this, there is another time, a cultural change that you have to implement.
Yeah, I would say that the cultural change is one of the most difficult, but in terms of things that we can measure in the scope of the pharma and particularly the clinical development, what we have observed is that we engage with the patient community early. The level of adoption of a clinical trial is much higher. Yeah. The level of adherence to the trial, the level of recruitment, the reduction in the number of amendments, and all that, there is obviously a high impact in the clinical development plan. So there is some metrics, still not perfect, I will say, and probably, as you say, we need to have some of them. After there is, also we like to tackle a topic about the cultural aspects, because when we see solutions, we can often see this solution is going to be implemented in the States, in Europe, but there is a lot of countries, and particularly the relationship between the patient and the clinician is very different across the countries. So I don't know if you have any thought about that, any experience. It's something that obviously we will need to have more flexibility. That means more money for every solution. So I don't know this, because when we talk about personalized medicine, sometimes we are thinking about biomarkers, but there is another market that is the cultural aspects, particularly in this context. So I don't know if you have any reflection to share.
For me, it's clear that you have different kind of patients. This is why it's so important to integrate the voice of the patients all the time, because if you integrate, and it's not to integrate, let me say, in the States, and then, oh yes, we have worked with patients from the States. They are very different, as you were saying, from patients from Europe or probably from another Africa. They don't have the same cultural approach, they don't have the same problems, and we come back to the beginning. We cannot suppose, we cannot talk about all the voices. One voice is not enough to include. It's not only to include one patient, you have to include a big community, be representative, and then you will probably you will arrive to the right point, but it's not always.
Okay, sure, thank you.
I think the general approach works anywhere. If you really, truly put the patient at the center of every way that the care is delivered. I was working with a system in the Middle East, trying to build their mental health care enterprise, and the key themes from the patient interviews that were carried out during that engagement could have come from the US or Spain or Mexico. People want the same thing, I think, from their healthcare. Yes, there are differences, there are nuances, but the way to detect those and to incorporate them into the delivery system, I think, is by empowering the patients to be the quarterbacks of their care team.
Johannes?
Interesting point. So I think on the one hand, we see large differences, like massive differences across countries. Like before, we already discussed US, for example, versus Europe. In the US, people are somewhat used to paying out of pocket. So for example, the consumer-focused companies in our portfolio, the US is still the holy grail, because in Europe, kind of people take healthcare products, all the services for granted, and it's super tough, you know, to go to the market quickly and trial with an out-of-pocket, for example, consumer product. Second, I think, are differences across social demographic strata. For example, people that come from high-income backgrounds are 80% more likely to use digital health offerings. Mm-hmm. So at the end of the day, we should ask ourselves which kind of people and social classes as well we can get involved into our data points. Mm-hmm. The same, I think, goes for gender gaps. For example, we are the most active femtech women's health investor in Europe. We have more than 10 investments in that area. And the data gap in women's health is just crazy. It's really, really bad. And that's one of the reasons why there hasn't been a lot of money flowing into that. And I see we're almost out of time, but the kind of note I'd like to end with is that we as investors, we are at the end of the day multipliers of these young, inspiring people that want to change our world, the well-being of people for the better. And I think we have a massive, let's say, responsibility to channel those kind of people to the important questions of life.
Okay.
Thank you very much.
Okay.